It starts so quietly you can talk yourself out of it for weeks. Your cat skips one jump to the windowsill. She sits a little longer before standing up. He stops chasing the toy he used to pounce on every evening. Then one day, there is a puddle just outside the litter box, a growl when you touch the back, or that look in the eyes that says, without words, I am not quite right. And now a lot of loving owners do something very human. They keep the small signs secret, even from themselves, because if you do not name the problem, maybe it is not real yet. I am Sister Claire Donnelly, your neighborhood vet, and today I want to talk about what happens to a cat when pain, illness, or behavior changes are quietly pushed aside because they seem minor, embarrassing, expensive, or just too hard to face, not to make you feel guilty. Quite the opposite. I want to help you understand what your cat's body does when discomfort lingers in the dark, why so many problems stay hidden until they are bigger, and how gentle early action can spare your cat real suffering. Cats are masters of secrecy. That is not stubbornness, drama, or revenge. It is survival biology. A cat in the wild does not advertise weakness. Pain makes a cat vulnerable, so cats are built to mask pain, reduce movement, hide, sleep more, and do less of the things that expose them. The problem is that what looks like laziness, aging, a mood change, or a fussy phase is often your cat compensating. And that compensation has a cost. When a cat lives with unaddressed pain, the nervous system does not simply pause and wait. It adapts. Muscles tighten to protect sore joints. Activity drops, so muscle mass shrinks. Grooming may become difficult, so the coat gets dandruff, mats, or grease along the back. The cat may stop climbing, then stop exploring, then stop engaging. Appetite can change. Sleep patterns can change. A sore mouth can turn a food lover into a picky eater. A stiff spine can make the litter box feel hard to enter. A cat with bladder inflammation can start to associate the box with pain and choose softer surfaces. A cat with kidney disease can seem merely quieter until dehydration, nausea, and weight loss have been building for months. Little hidden things often become whole body problems. This is especially true with chronic pain, dental disease, arthritis, obesity, urinary stress, thyroid disease, diabetes, kidney disease, and constipation. None of these always announce themselves with one dramatic symptom. They often whisper. A smaller jump, a slower stretch, hesitation at stairs, a different sleeping place, less grooming under the tail, more irritability with brushing, tiny changes in litter habits. These are not moral failings in the owner or the cat. They are the language of a species that evolved to hide vulnerability. So why do common fixes fail? Because common fixes often target the visible inconvenience, not the hidden reason. None of that addresses an arthritic hip, inflamed gums, crystals in the urine, constipation, fear of a covered litter box, or nausea from kidney disease. Sometimes the internet encourages a false sense of control. Add a supplement, change the routine, try a calming spray, rub the belly, give a little human pain medicine, which can be dangerous or deadly in cats. Cover the smell, hope for the best. The reason these fixes fail is simple. You can make the home easier for a cat, and that matters, but if the body is hurting, the body is still hurting. A cat can adapt to discomfort for a surprisingly long time. That does not mean the problem is mild. It means the cat is skilled. There is another reason common fixes fail. Owners naturally look for dramatic illness, vomiting every day, blood everywhere, a cat who cannot move. But chronic conditions in cats are often subtle at first. Mild dehydration can look like sleepiness. Pain can look like grumpiness. Weight loss under a fluffy coat can go unnoticed. Cats do not read the textbook for us. They improvise. Here is the real fix. Stop waiting for proof that your cat is miserable and start acting on patterns that say your cat is compensating. The earlier you respond to small, consistent changes, the more options your cat usually has, the gentler treatment can often be, and the more normal life you can preserve. That starts with changing one belief. Your cat does not need to be collapsing to deserve help. If your cat is jumping less, grooming less, missing the box, hiding more, vocalizing differently, sleeping in odd places, resisting handling, eating more slowly, dropping kibble, chewing on one side, drinking more, losing weight, gaining weight, or simply seeming not quite herself, that is enough to pay attention. Not panic. Pay attention. This is where owners become incredibly powerful. You live with the cat. You see the tiny shifts a clinic exam might miss, in a 10-minute appointment. A good veterinarian needs your observations. In many cases, the difference between early diagnosis and late diagnosis is not better equipment. It is a caring owner who noticed a pattern and spoke up before the crisis. If your cat has ever had a subtle sign that turned out to matter, tell me what it was and how long it took you to realize it was not just a phase. Your story may help another owner notice the same early clue in their own cat. Now let us talk about what actually helps. First, define the change. He seems off is real, but he no longer jumps onto the bed at night and now sleeps on the floor is more useful. She has started urinating just outside the litter box twice this week is more useful. He still eats, but only the gravy and then walks away is more useful. Clear details make better medicine. Second, think in terms of function. Can your cat still do the ordinary cat things that matter? Jump, climb, crouch, enter the litter box comfortably, groom the back end, chew normally, stretch, settle, rise after sleep, interact, and rest without tension. Cats often tell us about health by what becomes harder, not by what becomes impossible. Third, schedule the exam sooner than feels emotionally convenient. That phrase matters because many owners delay not from neglect, but from hope. We hope the weekend will help. We hope the new litter will help. We hope it is stress from visitors. Sometimes it is. But a timely exam catches disease at the point where treatment is often simpler. In older cats, routine blood work, blood pressure checks, weight trends, dental evaluation, and urine testing can reveal conditions long before an emergency. Fourth, make the home easier while you investigate. This does not replace diagnosis. It supports the cat. Use low-entry litter boxes if mobility is reduced. Put resources on each level of the home. Add steps to favorite furniture. Use wide, shallow bowls if whisker stress or neck pain may be affecting eating. Keep the environment predictable. Offer soft, warm resting spots. For some cats, a little traction on slippery floors makes a startling difference. Fifth, treat pain seriously. Pain in cats is under-recognized and under-treated. Arthritis is one of the biggest examples. Many owners imagine an arthritic cat as obviously crippled, but most arthritic cats simply become less cat-like. They jump less, play less, groom less, and interact on different terms. Proper pain control can revive personality, mobility, appetite, and litter box habits because the cat is no longer budgeting every movement. The right medication plan must come from your vet because cats process drugs very differently from people and from dogs. Sixth, look at the mouth. Dental disease is one of the most common hidden sources of ongoing misery in cats. Cats can keep eating despite severe oral pain. That is because eating is survival, not proof of comfort. Resorptive lesions, gingivitis, tooth root problems, and stomatitis can make each bite painful. If your cat has bad breath, drools, chatters the jaw, turns the head while chewing, drops food, avoids dry food, paws at the mouth, or seems moody when the face is touched, a proper oral exam matters. Seventh, respect litter box changes as medical information. A cat who urinates outside the box is not automatically being spiteful. Urinary tract inflammation, crystals, obstruction risk, arthritis, constipation, fear, location stress, dirty boxes, and painful associations can all contribute. Any male cat who strains to urinate, goes in and out of the box repeatedly, cries in the box, or produces little to no urine needs urgent assessment because urinary blockage can become life-threatening quickly. Eighth, watch weight with your hands, not just your eyes. Run your hands gently over the ribs, spine, and hips every couple of weeks if your cat tolerates it. A fluffy coat can hide significant weight loss. Sudden weight loss, even in an overweight cat, should be investigated. So should slow gain that reduces movement and starts a cycle of pain and inactivity. Ninth, use video. If your cat limps only after a nap, coughs in a strange way, twitches, breathes oddly, or refuses the stairs only sometimes, a short phone video is gold. Cats often hide symptoms in the clinic. Your video shows the truth of home. Now, there are caveats, because not every small change means disaster. Cats can be affected by weather, visitors, renovations, a new pet, loud noises, changes in litter type, neighborhood cats outside the window, and seasonal appetite shifts. A single odd day is not always disease. But persistent, repeated, or clustered changes deserve attention. The goal is not to turn every yawn into an emergency. The goal is to stop normalizing patterns that signal discomfort. Let me give you a simple working rule. If a change lasts more than a few days, recurs, involves eating, drinking, urination, stool, movement, breathing, or social withdrawal, or just feels unlike your cat, it is worth documenting and discussing. If your cat is open mouth breathing, suddenly unable to use the hind legs, straining with no urine, collapsing, having a seizure, or profoundly lethargic, that is urgent. Molly had stopped jumping onto the armchair, then stopped grooming her lower back, then started missing the litter box by a foot or two. Her owner bought a softer litter, then a bigger box, then washable pads. She was trying and trying hard. What Molly really had was a painful combination of arthritis and constipation. Climbing into a high-sided box hurt, crouching hurt, passing stool hurt, and she had begun to associate the box with strain. We adjusted her environment, treated the pain, addressed the constipation, and over the following weeks, Molly began using the box again, grooming more, and sleeping in her owner's lap for the first time in months. Nothing about that case required heroics. It required translating behavior back into body language. That is what I want for you and your cat. Less guessing, more translation. Now let us knock down a few myths that keep these problems hidden. Myth 1. If the cat is eating, the cat is fine. Not true. Cats can eat through dental pain, nausea, arthritis, early kidney disease, even significant stress. Appetite is one clue, not the whole picture. A cat who eats but eats differently is still giving information. Myth 2. Slowing down is just old age. Aging changes the body, yes. But pain is not a normal gift of age to be accepted without question. Arthritis is common in older cats, but common does not mean harmless, and it certainly does not mean untreatable. A comfortable older cat often looks years younger once pain is managed. Myth 3. Litter box accidents are behavioral revenge. Cats do not plan moral punishments. When litter habits change, think first of pain, access, stress, box setup, and medical causes. Anger from the owner can deepen the problem by adding fear. Myth 4. If it was serious, my cat would show me. This one breaks my heart because it sounds reasonable, and it is exactly why cats suffer quietly. The cat may be showing you in the only ways evolution allows. Less jumping, less grooming, more hiding, different posture, quieter purring, sleeping near the box. These are the signs. There is also a subtle emotional myth among very loving owners. I understand that, but reality does not wait for permission. Naming a problem early is an act of mercy because it gives your cat a better chance at comfort. So what should you do this week, practically? Take 10 minutes and watch your cat with fresh eyes. Watch how the cat gets up after rest. Watch the jump onto a favorite surface. Watch grooming. Watch the approach to the litter box. Watch how the cat eats, not just whether the bowl is empty. Feel the body under the fur. Check if there is less muscle over the spine or hind legs. Notice if the coat is clumping, greasy, flaky, or matted in places that used to be tidy. Listen for a different voice. Look for a different posture when sitting or crouching. Then write down 3 things that are normal for your cat right now and 1 thing that may have changed. Dates matter, frequency matters, videos matter. That little record can be extraordinarily useful 6 weeks from now when memory starts softening the details. If your cat is middle-aged or older, consider whether preventive checkups are frequent enough. Baseline blood work and urine testing are not about looking for trouble. They are about finding the early version of trouble when your cat still feels mostly like herself, and we can protect that as long as possible. And if cost is part of why signs stay secret, please hear this without shame. Cost is real. Say that to your vet directly. A good clinic can often help prioritize the most informative tests first, explain what is urgent and what can wait, and work with you on a plan. Silence helps no one. Information helps. The deepest truth here is simple. Your cat lives in the present tense. She does not know you are hoping the stiffness will pass, or worrying about the bill next month, or feeling embarrassed about the accident on the rug. She only knows whether climbing hurts, whether peeing stings, whether the mouth burns, whether the joints ache, whether the room feels safe. Your job is not to be perfect. Your job is to be curious, compassionate, and willing to act before the problem becomes undeniable. So, in one breath, here is the whole lesson. Cats hide pain. Hidden pain changes movement, grooming, appetite, and litter habits long before a crisis. Quick fixes often fail because they do not address the body. The real fix is to notice patterns early, describe them clearly. Get the cat examined, support comfort at home, and never assume eating, aging, or pride means your cat is fine. If you want more calm, practical help reading the small signs cats give before illness gets loud, subscribe and stay with me here on Woke Faith. I am Sister Claire Donnelly, your neighborhood vet, and the kindest thing you can do for a secretive cat is believe the whisper